It sounds counterintuitive, even shocking at first, that a medical checkup, something we've always been told is good, might actually do more harm than good, especially past the age of 70. But for millions of older adults, the very tests meant to protect their health might be silently undermining it. Not because doctors are careless, but because medicine doesn't always evolve as quickly as our bodies do with age. What was once preventive can become invasive. What was once helpful can become unnecessary, and in some cases even harmful. As we grow older, our bodies change, not just in strength or speed, but in how they respond to treatments, medications, and diagnostic procedures. After a certain point, the goal of healthcare should shift from aggressive prevention to preserving comfort, dignity, and quality of life. Yet, many people over 70 still undergo routine tests meant for much younger bodies, tests that often don't consider their stage of life, overall health, or personal values. These tests can lead to anxiety, misdiagnosis, or a cascade of further procedures that may never have been needed in the first place. It's not about avoiding care. It's about choosing the right care. And that starts with asking hard questions about whether every blood test, scan, or screening is still serving you, or simply serving a system that hasn't caught up to your reality. The hidden truth is that some routine checkups aren't based on your current needs, they're based on outdated models of health, designed with younger people in mind. And continuing to follow them without question can sometimes mean treating numbers on a chart instead of the person sitting in front of it. Understanding these risks isn't about fear, it's about freedom. The freedom to age with clarity, to make informed decisions, and to stop medical routines that no longer reflect your health priorities. In truth, being informed about the limitations of certain checkups past a certain age is one of the most powerful forms of self-care there is. It puts the focus back where it belongs, on you, not just your lab results. When we begin to look at health through a more age-appropriate lens, we start to see that more medicine isn't always better medicine. And that wisdom, not worry, should guide the choices we make from here on. For decades, preventive medicine has been the gold standard. Early detection, routine screenings, and regular exams were the pillars of a long, healthy life. But when we cross into our 70s, the conversation needs to shift. What once was a safety net can slowly turn into a trap. There's a fine but crucial line between smart prevention and harmful overtesting, and it often goes unnoticed until the consequences are already in motion. Overtesting can mean exposing the body to unnecessary radiation, biopsies, or surgeries, all of which come with real risks, especially for older adults. A simple test might uncover a harmless condition, something so minor it would have never caused symptoms or impacted your quality of life. But once it's found, the pressure to do something about it kicks in. That decision can lead to invasive follow-ups, stress, or treatments that offer no real benefit, but bring very real burdens. The healthcare system is built to find problems, and when it looks hard enough, it almost always does. But the real question becomes, is that problem worth solving? For someone in their 70s or 80s, the answer isn't always yes. Life expectancy, overall health, and personal priorities play a huge role in determining whether a screening or test is truly necessary. Yet far too often, people are swept into testing cycles simply because it's what's always been done, not because it's the right thing for them now. The most powerful approach to aging well isn't about undergoing every possible test, it's about being intentional. It's about asking whether a screening will add clarity or confusion, comfort or complications. It's about valuing peace of mind, not just information for information's sake. And perhaps most importantly, it's about recognizing that declining a test isn't neglect. Sometimes, it's the wisest form of care there is. When medicine focuses on the person, not just the protocol, the line between prevention and overtesting becomes much clearer. And with that clarity comes the power to choose what truly matters for your health and your life. One of the most underestimated consequences of unnecessary testing isn't physical, it's emotional. Imagine going in for a simple scan or routine blood test, only to receive a phone call that something looks suspicious. Your heart races. Sleep becomes harder. You search online, imagining the worst. Then, after more tests, a specialist visit, or even a minor procedure, you find out it was nothing. Medically speaking, it's called a false positive, but emotionally, the impact is anything but false. For older adults, this kind of psychological stress can be particularly heavy. It doesn't just affect mood, it can interfere with appetite, sleep, blood pressure, and even immune response. It creates a cycle where worry becomes a companion, always lurking in the background, ready to be triggered by the next test result or vague piece of medical news. And with each false alarm, trust in one's own body can begin to erode. These emotional aftershocks don't always show up in a medical record, but they shape quality of life in very real ways. Many seniors begin to feel trapped in a pattern of fear, going from one test to the next, always bracing for bad news. Instead of focusing on living well, they focus on waiting for results, for diagnoses, for answers that may never come. Over time, this hypervigilance can overshadow the simple joys of everyday life. It's important to remember that health isn't just the absence of disease, it's also peace of mind. When tests become a source of anxiety rather than reassurance, we need to step back and ask, what are we really gaining? And what are we unintentionally losing? Mental clarity, emotional resilience, and a sense of control are just as vital to aging well as any medical metric. Choosing to skip a test that could spark unnecessary worry isn't about denial, it's about balance. It's about protecting not only the body but also the mind, and ensuring that the pursuit of health doesn't come at the cost of living fully and calmly. Medical knowledge is constantly evolving. What was once considered essential practice 20 years ago may be viewed today with greater caution, especially when it comes to older adults. Over the past decade, major health organizations around the world have quietly revised their screening recommendations for people over 70, and for good reason. Scientific research has shown that, past a certain age, the risks of many tests begin to outweigh the benefits. But many people, including doctors, haven't caught up to that shift. Take cancer screenings, for example. Guidelines now suggest that some routine screenings, like those for prostate, breast, or colon cancer, may no longer be necessary after a certain age or health status. That doesn't mean they're never useful, it means they must be tailored. These changes reflect a deeper understanding that longevity isn't just about adding years to life, but adding life to those years. In many cases, the treatment of slow-growing conditions in older adults offers little improvement in lifespan or quality of life, and may instead bring complications or side effects that are hard to manage. Yet even with updated guidelines, the old habits persist. Some doctors continue to order out-of-date tests, either from routine or from fear of missing something. And patients, wanting to be proactive, often ask for every available screening, not realizing the new evidence might advise otherwise. The result is a disconnect between what modern science recommends and what's still being practiced in exam rooms across the country. Understanding these updated recommendations doesn't mean abandoning care, it means making care more precise. It means trusting in science not just when it pushes us to do more, but also when it gently tells us to pause. This is not about lowering standards, it's about adjusting them to reflect real, individual needs. Medicine today is learning to speak a more nuanced language, one that says, what's right for a 50-year-old isn't always right for someone at 75. When patients and families understand this, they're empowered to have better conversations with their doctors. Not adversarial ones, just informed ones. Ones that ask, is this test necessary for me right now? Instead of assuming more testing is always the safest route. At the heart of modern healthcare is a concept that's both simple and revolutionary. Not all patients are the same. This becomes especially true with age. While standardized care might work well in younger populations, older adults require something more nuanced, something more personal. This is where personalized medicine becomes essential, shifting the focus from generic protocols to tailored decisions that consider an individual's full story. Personalized medicine isn't about giving special treatment, it's about recognizing that treatment should never be one size fits all. Two people in their 70s may have completely different health profiles. One might still be running marathons, while the other may be managing multiple chronic conditions. Their needs, risks, and life goals are completely different. And yet, in many healthcare settings, they're often offered the same tests, the same timelines, the same assumptions. By taking a personalized approach, doctors can prioritize what actually matters. Instead of following rigid guidelines designed for the average patient, they can consider your personal history, family background, current conditions, and even your own preferences about quality of life. For example, A screening that might make sense for a healthy 72-year-old with decades of life ahead may not be appropriate for someone with more fragile health or limited mobility. Technology and genetics have also opened doors in personalized medicine. But even without advanced tools, the most powerful element is still conversation. When a doctor asks, "What are your goals for your health?" and truly listens, the path forward becomes clearer. It stops being about checking boxes and starts being about making decisions that honor both your health and your values. As we age, the goal should shift from maximizing medical activity to maximizing meaningful years. Personalized medicine helps ensure that treatments and screenings support that goal, minimizing unnecessary interventions while reinforcing care that aligns with your real needs. In this model, healthcare becomes more compassionate, more strategic, and far more human. And that shift doesn't just improve outcomes, it improves peace of mind. The most effective healthcare decisions don't happen in isolation. For older adults, especially those navigating complex health conditions or age-related changes, a smart health plan is rarely the result of a single appointment. It's built through thoughtful collaboration between doctors, patients, and often the family members who help support care. This partnership is where real clarity begins to take shape. Doctors bring medical knowledge, but family members often carry a deeper understanding of the person, their routines, concerns, fears, and preferences. When both sides are heard and respected, care plans become more grounded and realistic. A doctor may suggest skipping a certain test based on the latest research, while a daughter or son may express concern over a parent's rising anxiety after repeated hospital visits. These conversations create balance. They allow healthcare decisions to be informed not just by guidelines, but by lived experience. In many cases, smarter planning means slowing things down. Instead of rushing to schedule every possible test, the conversation can shift to what outcomes truly matter. Is the goal to detect disease early, even if the treatment may be harsh or unnecessary? Or is it to maintain stability, reduce stress, and protect daily comfort? There's no one right answer, but there is a right answer for each individual, and it's found through open dialogue. Families can also play a vital role in asking better questions. Rather than simply accepting a prescribed test or procedure, they can ask, "What will this test change?" Or "What are the possible downsides for someone at this age and health status?" These aren't confrontational questions. They're essential ones. They show care, attentiveness, and a desire to do what's best, not just what's automatic. When everyone is working from the same page, unnecessary testing becomes easier to avoid. Instead of chasing every possible risk, families and doctors can focus on the risks that actually matter. And with that focus comes not just better health decisions, but better peace of mind for everyone involved. For much of our lives, we're taught to follow schedules. Annual checkups, 6-month blood panels, routine screenings. These rhythms become part of how we measure our health. But as we age, those same rhythms can start to lose their relevance. What once served as a tool for prevention may become a ritual that no longer reflects what our bodies truly need. At some point, the wisest path forward is not to follow the calendar, but to follow ourselves. Listening to your body means paying attention to how you feel, not just what a test says. It means noticing changes in energy, sleep, appetite, memory, and mood, and using those signs as real indicators of your health. A routine exam might miss something that your daily experience is already telling you. On the other hand, a test might find something you'll never feel, never suffer from, and never need to treat. In those moments, your lived reality should carry more weight than a laboratory result. Rigid medical schedules can also create a false sense of control. They make it easy to believe that staying on track equals staying healthy. But the truth is, good health in later life is far more complex and personal. Flexibility becomes a strength. Wisdom means knowing when to follow the system and when to step back and ask, "Is this still right for me?" This doesn't mean ignoring health or avoiding medical care. It means being mindful. It means acknowledging that your experience matters just as much as a physician's chart or a national guideline. And it means accepting that slowing down, skipping a test, or changing the pace of care isn't giving up. It's choosing a better fit for who you are now. By trusting your body and allowing yourself to shift away from rigid protocols, you create space for more meaningful care. care that respects both your needs and your intuition. Because at this stage in life, wisdom often lies not in doing more, but in doing what truly makes sense for you. Aging brings challenges, yes, but it also brings clarity. The clarity to see that health isn't just about fighting illness at all costs, but about living with presence, comfort, and dignity. Reclaiming your peace starts when you stop feeling pressure to chase every possible test and start trusting your body, your choices, and your care. The right care at the right time doesn't ask you to do everything, it asks you to do what matters. There's freedom in letting go of what no longer serves you. Freedom in choosing not to undergo a test that offers little benefit. Freedom in saying no to procedures that only add confusion or discomfort. And most importantly, freedom in focusing on what truly supports your well-being, like movement, connection, good sleep, meaningful conversations, and a care plan that reflects who you are, not just your age. The idea isn't to avoid medical care, it's to reshape it, to redefine it in terms of personal relevance and purpose. Sometimes the best care means close monitoring. Sometimes it means doing less. And sometimes it simply means honoring the wisdom that comes with age, the ability to say, I know what's right for me now. Peace doesn't always come from more tests or more data. Often, it comes from feeling heard, respected, and involved in your own care. From being seen not as a checklist of risk factors, but as a whole person with a lifetime of insight. That kind of care restores trust, not just in the system, but in yourself. As you move forward, know that reclaiming your peace is not passive. It's a powerful, active choice. And it begins with confidence that you have the right to question, the right to pause, and the right to protect the life you've built, with care that honors all of it.